This is Dr. Lam from drlam.com and the Adrenal Fatigue Center. Today we're going to talk about a common problem that some people experience when they're doing, for example, exercises, that their head is not in the right position, leading to dizziness. Now, dizziness can be due to a variety of factors. Most commonly, when it is related to postural change, we call it postural blood pressure problems. Now, the body's blood pressure is regulated in many ways through an automatic mechanism. And when the body's head is below a certain level, in order to get more blood to the brain, the body's blood vessels automatically constrict. And that is intended to bring more blood to the brain so you don't faint. Now, when this mechanism is defective or not functioning well, then problem can arise. For example, you can feel dizzy, you can feel the room spinning, you can feel even nauseated, you can have headaches, and in severe cases, you can faint. So the first thing you have to do, if you do have this type of experience, is to get yourself back to a situation where your head is level or above your heart, so that your body has the ability to regain its composure. The medical workup, including cardiac as well as neurological workup, will include checking out your heart, making sure that your carotid blood vessels are okay. There's no blockage. Make sure your heart is not having any arrhythmias that causing the heart rate to be dysregulated during these situations. Make sure that your ears and your nose are okay so that you don't have any postural changes that can affect your balance. Metabolically, you're going to make sure that your sugar is not low beyond a certain point. If everything checks out, then chances are you'll be told that this is postural related. And really, there's really not much you can do if that's the case, if everything works out. In the case of adrenal fatigue, we do see some postural changes, and oftentimes this can be improved with increasing the vascular volume, such as with more fluids as well as more salt. Regulating and normalizing blood pressure often can also be beneficial and helpful. As far as exercise, you have to moderate yourself. Oftentimes, when the body is in a state of adrenal fatigue, the fight or flight response can be activated. And when this happens, dizziness can occur as well. So there are many, many reasons. And you want to make sure that there's no conventional medical reasons that you cannot check out. If everything turns out to be normal, do look into adrenal fatigue, because it is very common. And the good news is that oftentimes these are self and spontaneously healing signs. And as your body gets stronger, if it is indeed related to adrenal issues, then oftentimes it gets better by itself. Taking medications can have its place if the situation is severe and you don't want to be in a fainting situation, which can be dangerous to yourself and others. So, regulating blood pressure, etc., can be considered with conventional medication. The problem with this is that if you overregulate, you can be a little more dizzy and a little more calm, and sometimes walk around like a little zombie because you can be sedated in order to avoid these problems. At the same time, if you don't look at the underlying problem and resolve it, then these masking medications can actually be detrimental and negative to your overall health over time, because your problem underneath is really not resolved. If it's a matter of simple insufficient salt or adrenal weakness, then there are simple ways you can do, from lifestyle, nutrition, and supplementation, that can help with the adrenals, and then the postural blood pressure changes can resolve. So these are the first steps you should take. However, especially if you are older and you have previous history of heart disease, then you need to see your doctor first and make sure there's nothing else going on. I hope you've enjoyed this video. For more information on this topic, head over to drlam.com, where I've written over 1,000 articles to help educate people. You can also call me at 626-571-1234 for more information on adrenal fatigue and how to navigate it. Finally, if you enjoyed this video, please subscribe to my YouTube channel. Thanks for watching.